Meanwhile, President Obama is meeting with the HHS secretary to try to deal with open enrollment and some of these other issues that have popped up, including a lot of folks who are going to be looking at paying a penalty if they don't sign up or rejigger what they already have. That could be a problem right there, because some folks are looking at paying the penalty as a cheaper alternative to signing up for a system where premiums are moving up at a 25% or better clip. To Trump's senior economic advisor, Steve Calk, on what Donald Trump's answer is to this. Now, as far as I know, Steve, Mr. Trump's view has been, you know, rip it up, start from scratch, but in doing so, millions of people who already have insurance would lose it. How is he going to address that?
Well, look, I certainly understand the concern. It's important that the American people understand the math. Look, we all know that this Hillary Clinton Obamacare plan has been an absolute failure, not only in matters of health, but in matters of what it's costing the American people. We know now that premiums will increase in most states between 25% and 116%. But what people may have missed is that those premiums actually compounded over the last 4 years have increased over 100%.
Oh, I know.
I mean, those folks.
So what would you do?
Sure.
What do you think Donald Trump does? Would he just stick to that? These people are out of luck. They lose their insurance, and he starts from scratch.
Absolutely
or what?
not.
So what would he do?
Absolutely not,
What's he going to do?
He's not going to let the people of Pennsylvania have a 53% increase. The people of North Carolina have over a 40% increase.
So what's he going to do?
He wants to replace and repeal it with HSA's great health savings accounts. He wants to increase competition by allowing insurance to be purchased across state lines.
Would that be instantaneous? Because replace
as soon as he can
means
get the Congress to pass it. Sure, absolutely. And also, in addition to allowing people to purchase insurance across state lines and increasing competition, driving down costs and premiums, he also wants states to be able to manage Medicaid and get rid of the waste that exists there. In addition to cutting red tape at the FDA, you know, there's over 4,000 drugs awaiting approval. These are life-saving drugs that need to get into the hands of Americans that are desperately hoping to save their lives.
I just want to be clear, because there would be no gap there for the. Again, these numbers are all over the map, but the 15 to 22 million people who now have insurance or didn't have it before, many of whom are going to be paying, you know, a lot more for that luxury. He would not do anything to take that away from them. Whatever he changes would simultaneously be switched in with whatever he's offering.
That's exactly correct. Look, Mr. Trump does not want to punish the American people. He wants to help the American people. He wants to move government out of their lives, but ensure that the safety net still exists. And he wants to do that through common sense reforms. Look, we have to stop this policy of ready, fire, and then aim. We can't have any more of this, hey, let's pass it so we can see what's in it. If you think about the fact, Neil, that if in fact they knew that these massive increases were going to take place, this may well be the greatest fraud ever perpetuated on the American people. It never would have passed.
If people had known this, it never would have passed.
Never.
That is true.
But if you knew about it, isn't that the very definition of fraud, Neil? If you knew about that crime?
If they did know about it, because they are going to get one thing I think they might have wanted all along, that is a single-payer system or a public option. But they're going to get what they wanted here. But it's going to be a mess.
Well, if you want to be a socialist nation, then that's what's going to happen. And all you can, you're talking to a guy that grew up in England. You're talking to a guy that constantly talks to his friends in Western Europe. They are the first to admit that is a failed system. It does not work. We must stick with improving the American system of health care to help the American people and drive down those costs.
Yeah, and with all that, they don't even have dental coverage. And if they do, it's obviously not yielding the results they hope. Steve, thank you.
And no one uses it. They
not.
search for private answers.
No, exactly. Steve, thank you very, very much. Good seeing you.
Thank you, Neil. Good to be with you.